RF microneedling, Botox, soft lasers, and also feeling, volume, even better.
God, I feel like I want to get that done now.
Yes, and also another treatment.
Hello.
Hi, everybody.
Habibi,
Hi,
welcome
Bibi.
to Dubai.
Yeah, guys, we are filming a very, very special episode of Trendy Talk from Dubai.
We are indeed. And as you can maybe see, my mum and I are hooked up to something very interesting looking, which we will tell you more about. Not only is this episode very special because we're here in Dubai, but we are sitting with anti-aging guru, doctor and master of longevity. It is Dr. Lica.
Thank you. Thank you for having me here.
We're so excited.
Thank you for coming. We are so excited about this.
We
Me too.
obviously know Dr. Lica, not only from following her on social media, but we've been lucky enough to have a few treatments with her.
Some lovely treatment.
Just a few.
Really nice.
Which we are going to tell you guys all about. But for those of you that don't know you, tell us a little bit about yourself. Where are you from? What do you specialize in?
So I'm a dermatology doctor with experience in aesthetics and also regenerative and longevity medicine for more than 20 years. I'm originally from Moldova, but already for 3 years I'm here in Dubai, and here I really started to practice a lot longevity and regenerative medicine. I also finished American Academy of Regenerative Medicine, so it's where I'm so happy that I really can have a practice with my patients, and I see amazing results by combining aesthetic and regenerative medicine treatments.
And of course, you're at a beautiful location. So
Yes.
Dr. Lica is at the Aeon Clinic here at the Atlantis Royal. It is an amazing setup.
It is it's beautiful, and it's so relaxing as well.
Yes, it's really the first regenerative and anti-aging clinic here in Middle East.
Yeah, it's amazing. So here in Dubai, the anti-aging topic is so hot. So when have you realized that come in the last year or 2 years? And do a lot of people come here specifically just to focus on that?
Yes, I would say that especially 2 years, but especially the last year, everybody talk about longevity, about regenerative medicine, about feeling younger, about maintaining this health span. So not just to live longer, but to live better and with a good quality of life. And because now here in Dubai, it's like a hub of longevity treatments, and we have here a lot of treatments at official level, because, for example, a lot of treatments like stem cells, exosomes are not approved yet in Europe, even in USA, and that's why a lot of people come here to do these treatments.
Right. So talking about something that's not really approved in Europe, my mum and I are currently doing something called NAD.
Yes.
Now, that was, I don't know, why did I...
Who introduced you to
I don't know. Someone mentioned Ez.
Right.
Okay, I've got a friend in Mallorca and she's very much into her skincare, etc. And she started talking to me about NAD. And I was like, what is this? And she was like, it's like the best anti-aging thing you can get, but they don't have it here in Spain. And I was like, okay. So I had planned a trip here to Dubai, and I was like, oh, the Aeon Clinic, I'll look it up, it's in the hotel. And I was like, oh my God, they've got NAD. I was like, that's it. So I was like, no, I'm going to Dubai to get NAD done. So tell us, what is NAD?
Yeah, so NAD is a nicotinamide dinucleotide. It's a substance that normally is inside each of our cells. Imagine we have around 30 trillion cells in our body, and each cell normally contains this NAD. But with age, the level of this NAD substance declines, and that's why we need it, but we need it in order to produce energy, because our cells produce energy with NAD. If we don't have NAD, our cells cannot function, and as a result, our organs cannot function properly, and our body also cannot function properly.
Okay.
So with what Lauren and I are doing just now, doing an IV, this is the most effective way of doing it. If you were to take it in a tablet or something, it wouldn't be maybe just as effective.
Yes, exactly, because NAD in the tablets do not work. It is another supplement. It is called NMN. It's like a precursor. So we can take only this supplement, and then our body will transform NMN in NAD. But directly NAD we can get only through
I
IVs.
have NMN. It's over there.
Yeah.
I bought it here in Dubai, so guess what we're buying more
this
of.
also, but you can continue after.
Yeah.
So we do few treatments with NAD now, and then you continue to take NMN
I think I've
to
taken
maintain.
NAD now this is my fourth time, I think. And
So I'm behind you then.
Yeah, we started off with a minimum dose the first time that we did it. And everyone always goes, how do you feel after? How do you feel after? I mean, honestly, remember, we feel energized after it.
I do.
Yeah.
For sure. I think
Next day or
no,
even
immediately
immediately
after.
I'll tell you a story. The last time we had it, I actually came in not feeling that great. I was feeling a bit run down, been working a lot,
tired.
and feeling really tired. I had the intravenous, and afterwards I felt fantastic. I felt really good. I felt really, ready to take on the next day. I felt refreshed. I felt bright. I felt everything so much better. And I thought, I've got to continue with this.
I think
It really has.
With it, I've done it also with you kind of in the evening, afternoon times. And I think the best time, because I feel energized after it, I feel like I can't sleep that well after it.
better in the morning.
Yeah, better in the morning, I would say.
Yes.
So this is definitely a great treatment to have.
It's like you charge your iPhone. So the same, we can charge our bodies with NAD.
How often should someone get NAD?
Usually we do like a free treatments once in a week, like a course more active, and then we can do it once in 3 months to repeat it. Or it also depends, we can also do like maintenance treatments. For example, once in a month, we can do one treatment. After we do a series of treatments of 3-4, then once in a month, just to maintain.
Yeah. And honestly, like, it's so great that with you can also do one of your facials while having NAD, which is like what I like to do, because I like to do something while I've got the IV in. I'm not great with needles.
No.
Either
it's good. It's a distraction, so it's good that you are having the facial.
It is.
Facial was amazing, I have to say. It was
and because it activates your cells, it activates also skin cells. So that's why this glow appears.
Yeah. Let's talk about the treatments that we've had done with Dr. Lica. See, to be really honest, I do just turn up. I trust Dr. Lica so much that I'm just like, she's saying all these things, and I'm like, yep. I'm like, I don't even know what that is. And then afterwards, I'm like, so what was that? So tell everyone a little bit about the treatments that we had with the diamond facial. What is the diamond facial with you?
Yes, it's a combination facial that contains like a series of steps. First, it was like hydration peeling to remove the dead cells and to prepare the skin. After, we did a non-invasive laser to activate the skin and to activate the collagen production, and also to make the skin more receptible for the active ingredients for mesotherapy. After, we did mesotherapy with microneedling with the glutathione, hyaluronic acid, amino acids to hydrate from inside and also to boost energy production into the...
That, like, I mean, it sounds so weird, but when we were having it done, first of all, the laser that you did was pico laser,
laser, yeah.
Okay, do you remember I had that done once?
Yes.
In Mallorca, and I was in tears crying.
Yeah, that was horrific, yeah.
I had it done once in Spain, and it was so painful.
It must have been too strong. It was too
my
fierce.
God.
That was...
But it depends on the energy that
Jesus Christ, the energy was high, I tell you. Because when you said pico laser, I was like, oh shit, here we go. But I was like, no, just trust her. And it was like very small little, like a ping.
Yeah.
But that was it. And I'm good with like pain.
Yes.
You know, I'm like, yeah, bring it on.
Yeah, I know, because I also did the needles for you.
So I was like, whoa, when I had it done in Spain, I nearly died. She did one half of my face and I was like, listen, I was like, I don't care about the other half. I don't care. So then afterwards, when you did the
microneedling
therapy,
I could smell like this medical smell going into my face and I loved it.
Yes, because I used also glutathione. So glutathione is a powerful antioxidant that gives the effect of rejuvenation for our cells. And also because we also use it in IV.
Exactly.
In the same time. So that's why you had like a double effect from inside and from outside.
So after that,
that, we did also mesobotox.
I know, Botox. She said that to
amazing.
me.
I was like, yes, bring it on.
Yes, she said that. She was like, yeah, we're going to do Botox. And I was like, yeah. And people maybe watching this are like, what the hell is that? It's basically, for a non-medical term, it's Botox all over your face. But it's not.
It's really like a skin Botox, because normally if we inject Botox, I inject it deep into the muscle till 5-6 millimeters. But here it's only on the 1 millimeter. So what it does, it first of all, it shrinks the pores, it prevents this oiliness of the skin, and also it shrinks the vessels and gives this glowing effect and removes these finest lines. And that's why it gives this immediate glowing and lifting effect on the superficial layer of the skin.
I tell you, see, I'm a bit weird. I'll get addicted to things. And if I had the needles and the Botox, I'd be doing it every morning.
Do you know, Lauren said to me afterwards, she said, how do you feel, Mum? I said, I feel deeply cleansed. That was the only way I could describe it.
Like, it was like we felt so refreshed.
It was so good.
Like, we felt snatched, refreshed, everything afterwards.
I didn't want anything to go on my skin, because I thought, no, it's poison.
I know, we were like, don't touch our skin.
Don't touch your skin.
We loved it. It was so good.
Really, I'm so happy for this.
So that's the diamond. So it finishes with the mesobotox?
And then after we applied also peptide mask with the stem cells and exosomes.
That was amazing.
Yes.
What is this
exosomes?
What is this?
The exosomes are small vesicles that our cells produce in order to communicate with each other. So we ourselves need to talk. Like we talking now, we produce the sound. The same our cells, if they need to communicate, they produce these exosomes, and they stimulate all the processes. For example, the cell has to regenerate, the cell has to rebuild, the cell has to produce collagen. And
it's amazing.
Yeah, and through this exosome, they just activate our cells. It's not just a foreign substance that we put, but we just put the messenger to activate the skin.
Wow.
So much. It's on the natural level.
Science behind it.
Yes.
You know, like when I was growing up, if you cleansed, toned and moisturised, you were high maintenance.
Yes.
And nowadays, there's so much information out there. There's so much, more goods.
What is, I mean, you also, because you're such an expert, but you also go to these workshops to really stay on top of things.
Absolutely.
What in your eyes is like the kind of, let's say for this year, the kind of hot thing to get done, or a new treatment? What is...
Or the new trend.
The new trend. What is like the new anti-aging trend that's coming up, or is?
Yeah, so the trend is now on regenerative aesthetics and regenerative medicine. It's combining of like NAD with the ozone therapy, photobiomodulation with laser. So combining light,
ozone therapy, is that when you go into
Yes.
The chamber.
Ozone therapy is when we also use the blood. We ozonate the blood. So we take your blood, like 100 to 200 milliliters. We add the ozone, active oxygen, and when we infuse it back in your vein. And like this, we do 10 times. It's like 10 pass out of chemotherapy. So we activate your own stem cells. We destroy all bacteria, viruses that you could have. It gives a very good effect, anti-inflammatory, and also activates mitochondria. And then NAD will work better. Even better.
God, I feel like I want to get that done now.
Yes, and also another treatment, which is EBU treatment, which cleanses all your blood. So, for example, we take the blood from one vein, it passes through a special membrane to clean from heavy metals, toxins, any bacteria, viruses. Then we add ozone and we infuse it back in another vein. So it's like complete blood cleanse.
I mean, I feel like I would love that, but it's the whole needle thing.
Yeah, to me that sounds like, you know, when you hear that people are, they've got the kidney problems and they get the dialysis.
Dialysis, yes.
Is it like that?
Something like that. So it passes through membrane and cleans. Yeah, but this treatment is fantastic, and if the patient has chronic inflammation, any autoimmune diseases, chronic fatigue, yes, it's great, and like anti-aging to prevent. It's amazing.
What's like your most requested treatment that people are asking for?
I would say now it's people are focused on the quality of the skin, and I'm very happy for this, because before it was a focus on, for example, filling, volume. But now everybody understood that really skin tells us about our age, and it really tells about what is going on in our body.
For sure.
And that's why the treatments to improve the skin quality are now the top. So RF microneedling, this Botox, soft lasers, and also peptides. Peptides work fantastic together with exosomes and stem cells already, if the patient needs.
Yeah. So who would you say is your client base just now? Would you say it's mostly women in their 30s, 40s, you know?
It's really from 20s till 80s even, we have the patients. So, but the majority, I would say, maybe 30s, 50s.
Yeah.
Okay.
And do you see like more men coming into the clinic as well?
Yes, for sure. I remember when I started 20 years ago, maybe it was like 10% men, 90% women.
Yeah.
But now I would say 65%, maybe 60% women and 40% men.
I would love my husband to go in there. I would love my husband to go and see you. Oh my goodness. I'm always like lifting and pulling and everything. He's like, oh my God, just leave me alone. I'm like, I would do it myself. I'm like, you need this done. You need that done. He's like, thanks.
So what ingredients would you say somebody should prioritize on? And the reason I'm asking is, as I said, when I was growing up, it was you cleanse, tone, moisturize, end. And now I'm hearing words like hyaluronic acid, retinol, peptides.
Yeah.
I've got to be honest, I'm clueless. I don't know. So what would you say prioritize in the skin routine, and how best to do that then? Yeah.
For skin routine, I would say we have to be not so aggressive, and it's never better not to use too many products in the same time. So this is important. So for in the morning, I would say it's vitamin C serum. It can be also with niacinamide to activate and to have good effect of antioxidant, and also sun protection. So this is the absolutely important in the morning. In the evening, yes, we can use retinol to stimulate skin regeneration, anti-wrinkle, and to prevent pigmentation also. We can use peptides because peptides are amazing for skin texture and quality, especially GHK-Cu copper peptide. It stimulates and firms the skin really immediately. You can see the results in 2 weeks. Visible. And then moisturizer, so good moisturizer, and that's enough.
I do feel that sunscreen with, let's say, also like my generation, so I'm in my 30s, I feel like it is, before I think it was like really uncool. It was like, oh, I'm not wearing like sunscreen.
Yeah.
And also, like, if you did buy one, it was like, oh, I'm buying like factor 6, which does
a low number.
nothing.
If you bought something like factor 30, it was like, who are you?
It was like, whoa, okay, grandma.
Yeah.
But now it's like such a thing.
It's reversed.
Yeah, it's reversed. And even like when you go into places like Sephora, they've got all these cool brands now with so much like sunscreen options.
Absolutely.
That I think it's kind of like a cool thing that people are realizing.
So nowadays, what I've noticed is that you can't get any sunscreen less than like
True,
30,
you never
20.
see 6 or anything anymore.
No,
And if you do get it, they've had it a long time.
Yeah.
Because you don't see it now. You know, a lot of the supermarkets, even it's 30 and 50.
Yeah, because really sunscreen is not only about aging of the skin, it's about preventing of cancer, skin cancer.
Yeah.
And it was studied that rate of cancer, if we compare with 1970s and 2000s, increased by 700%. Imagine
Really? Oh my God.
skin cancer like melanoma, which is most aggressive skin cancer, 700%. So it's a lot. And that's why it's really important to prevent.
Guys, this is an Amy Lauren alert to subscribe to our YouTube channel, Trendy Talk. There's nothing better than every week getting a reminder from me and Mama Jen that a new episode is out. So remember to hit that subscribe button. And if you want, you can also give us a little thumbs up. Back to the episode.
Would you say, like, for example, there's some, I mean, my mom's very accepting of this. Like, I will say to my mom, like, Mom, you need to get this done. She's like, okay. And I'm like, Mom, you need NAD. And she's like, I have no idea what this is, but okay, fine.
I trust you.
But there is some people out there that you're like, oh, you should try this for anti-aging. They're like, me? Like, I don't need anti-aging. Like, and it's like, but you do. When would you say, is there a start age for this? Is there, you know, for example, I started Botox when I was 23. And it's because I noticed this line I was getting and I was like, that's the line that my mum has. I'm not really liking that.
Yes.
And I was getting it done. And I remember like my boyfriend was like, you're too young. Why are you starting? And I was like, I'm preventing.
Yes.
And I was like, I don't want to get older, especially like my husband's German. So I'm very, you know, surrounded by German opinions. And they're like, you know,
They're very conservative.
they're very conservative. And also, for example, when they've got a deep line, they'll be like, oh, maybe I should think about getting Botox. And I'm like, no, you're too late for that, love. Like, now you need filler. Because if you did the Botox while I was doing it at 23, you wouldn't need the filler now. You'd have just been doing a little Botox. So when is an age to start with an anti-aging process?
Yes, as you said, the prevention is key here. So it's much better to start to do, like you said, Botox to prevent the appearance of wrinkles. And the same with the anti-aging. So we can start from 20s to prevent. But first, I not talk about that we need to do a lot of treatments from inside, from 20s. But we can start with the lifestyle, with the diet, with exercise, good sleep, less stress. And then, of course, we have already good effect. But starting from 30s, it's already important to prevent. And then we will feel better and we will not need so heavy treatments after 40s and 50s. Like exactly as you said with the Botox, but the same, it's from inside.
Yeah, so like, you know, like hydration is obviously very important.
Yes,
and
absolutely.
Because again, I think it's a generational thing. When I was growing up, if you said you were having like water or something like that, I'd be like, why are you having water? You know, it was, you know, that's poison. But I think nowadays, you know, it's so much more acceptable. You know, people are walking about with like the water bottles, you know, and all that kind of thing. And it is very diet orientated. I hear, you know, people asking about sugars, what foods, what milks, what everything contains. Whereas I think when I was growing up, nobody cared. Nobody asked these questions. Whereas nowadays it's so much more acceptable to ask these questions.
Yeah.
You know.
Yes.
I think another thing is like, it's such a huge like topic and such a big topic that's what I really love with like someone like yourself. Like you can go to the Aeon Clinic, you just sit down with you know, like you sat down with us and was like, okay, tell me. And one thing that I think is really great is like we've done blood work. We're waiting for our results. I can't wait.
Yes.
I'm like, we did a lot of blood work with you, so we know exactly like what's happening, what page we're on, and you build a program from there. And I think so many people are like very lost with this, where they can hear one thing, you know, especially with social media, where you hear things and you're just like, oh, at the end of the day, somebody's trying to sell somebody.
What's true, and what's just, you know, people promoting products. Whereas going to somebody like yourself that knows exactly, and you're very defined and very, you know, exact about it, that's what we need.
And I think these things for people that are watching, like, it's very custom. If something works for you,
it
then
doesn't mean,
you know, like, you just have to choose your customized plan. If something works for me, it might not work for you. It might not work for them or whatever. It's a very customized thing. So it's something like just to be careful of.
Absolutely, because that's why before we do a diagnosis and complete blood work to understand what, because this is medical treatments, and each medical treatment has indications but also contraindications, and sometimes we can really harm, and that's why we need to prevent it. And absolutely it's important.
Yeah, like the other day there when, you know, you and I were speaking, you asked me about the menopause and was I on hormone treatment, you know, HRT and everything. And I think that's another minefield that a lot of women that in my age group, in my sort of bracket, that's another thing that people are very kind of sceptical about. Some women are, oh, no, I would never take it, whether I was like, bring it on.
Yes.
Because I thought there's absolutely no way I'm going through all this nonsense. And I think also that's a thing that people don't realise is that the menopause affects your skin also, and you change completely from how your skin was in your 20s and 30s to how it is in your 40s and 50s. You know, how would you sort of say to women, what's the best sort of advice you would give somebody going through the menopause then?
Yes, I would say that better to start earlier. So we usually women start to think about it a little later. So when the first signs appear, it's even hormonal levels can be normal, but the woman can feel something, that her skin becomes more dry, that the skin is less elastic, that she has these mood swings, or maybe she wakes up during the night. So all these are signs of premenopause. And then it is important to start the treatments. And now there are not only synthetic hormones, but bioidentical hormones, which are plant-based. And it is possible to start from them, to use them till the age where we already have the menopause, and after to switch to the synthetic hormones. But of course, before, we need to take all the tests to be sure that the women do not have contraindications. And then, yes, for sure, it's absolutely important, because it's not only about how the woman looks, it's about how she feels, and all the body, even the muscles, because we lose the muscle with the menopause. And sarcopenia is the most important also aging factor when we lose the muscle.
I think the first sign of like your aging is like your hands, right?
What we can see, yes.
Because the other day I went into Dr. Lica's office and I was like, I want to get Botox in my hands, and she was like, no, we're not doing that. What kind of anti-aging treatments can you do for hands? Is it like laser maybe? I don't know.
Yeah. For hands, really, we can do all the treatments that we do for the face.
Yeah.
It can be lasers, but we need to do more softer treatments.
Yeah.
Because the skin on the hands are thinner and more dry, and it contains less sebaceous glands. So less oily. So we never see this oily on the hands. So that's why we need more hydration.
Right.
So skin boosters, polynucleotides, exosomes, soft lasers, not aggressive ones. Yes, and then we can maintain. And sometimes we can use also fillers under the skin to firm it.
And is that the same for the neck?
And the same, yes.
Yeah, for the neck.
I just feel like I don't like my hand. Like I don't know. I just feel like sometimes like when I get my nails done, I take an Instagram picture. I'm like, God, I don't like my hands.
Can I ask you a question?
Yeah.
When you go to do your nails, do you apply sun protection?
Right. Hold on a minute. No.
Yes.
You do not realize inside of me, I have, see that black bag there?
Yeah.
That bag is like my little emergency kits, right? And how many times do I go and get my nails done and I'm like, put your sun protection on, put your sun protection on. I'm going to be one of those girls who's just got everything. It's like, I'm doing it. I've done my 6 million steps. I've done my 10 hours of sleep.
Yes.
I've done my la la la. And do you know how many times
my meditation,
my fucking hands are underneath that light and I'm like, shit, you forgot to put the stuff on. And I'm like, and then one time during it, I was actually putting on my sunscreen.
Yes.
And the woman was like, oh no, but don't get the cream near the nails. And I was like, I'm trying my best. But as the girl that told me about NAD, she has a place in Scotland and they do lashes and brows.
Yeah.
And she's like an ultimate girl boss. She's got like 15 girls working for her.
It's incredible.
And they do nails.
Yeah.
And she says that to her regular clients, they have these special gloves that have like holes for your nails. And the gloves are like sun protection.
Yeah. Yes. This is absolutely important because imagine it's practically 1 hour.
I know.
We stay under this UV light and that's why we have this sun damage and photoaging. Aging because of the sunlight.
But don't you think these places, like if I owned a manicure place, I would so have like little cute sun creams or like the gloves, like, but they don't warn you about that, do you?
Yeah.
Oh, I know. I'm so, that's why I feel like I kind of want to restart. I'm like, can I restart from the beginning? Because I feel like, and it's not your fault. You just didn't, you just didn't have the knowledge. But one of my issues with my skin is pigmentation. Now you don't see because I've got a lot of makeup on, but I have a lot of pigmentation on my forehead. And that came from when I was younger. I used to play a lot of golf. I played professional golf and I was in the golf course for like 7 hours, 8 hours, like the whole day. And I think I would apply like one sunscreen.
Yeah.
And it would be again like your factor 10, your factor 15. And no offense, but it wasn't as if it was like the high quality stuff you get from the pharmacy. It was like some Nivea spray or like, do you know what I mean?
Yeah.
But we didn't have the knowledge about that, you know, back then. Or my parents didn't know about that. And that is one thing, it's the sun. It's the sun damage. And now I'm really into like my sun creams.
Yeah, I know. I mean, I think, as you say, it's the education of it all. And that's what, you know, I think it's a generational thing. I think nowadays so much more information is out there.
Yeah,
absolutely.
People have access to the internet. People have access to social media. Whereas when I was growing up, you
Nobody
didn't have that.
And I think now it's cool to have these sun like care brands have made it like cool. The packaging's cool.
Yeah.
You know, like you've got things like that Kosas stuff that we were buying. That's got everything kind of has sun protection in it, which is nice. Can you tell me a bit about the red light therapy? So I love doing that, and I feel like it gives you like a good endorphins. You kind of feel good after it, don't you?
Absolutely.
So what is the red light therapy? What does it do?
Yeah, so red light, it's a light that activates not only your skin and improving the skin quality, but it really activates your mood because it stimulates the production of energy. So like NAD now restores,
We're gonna be like
we
this.
restore this energy level. The same we can do with the red light.
Yeah.
So, and if we use red light bed, it will activate mitochondria and will activate each of your cell, and as a result, you will feel better, you will be more energized, and your skin will look amazing. And here we can also choose the frequency. It's not only light, but also about the frequencies. The light then will penetrate at a different level. So, or we want only the skin, or we want, for example, to work with the muscles. We want to work with the bones. We want to work with the brain level.
So
or we want
I've
gut.
done it at the Aeon.
Yeah.
But I don't know what.
I think we did.
I was sweating.
Yes, I think we did for skin and maybe for muscle because
Maybe.
for you because to restore the muscle.
I was like,
and for healing, yes.
it was getting a bit sweaty in there.
Yeah.
I was like, right. And I seen also at the Aeon, you've got the little chamber.
Yes.
So it's like a chair. Yeah. It's like you're in a very small airplane.
Yes,
And is that pure oxygen you're breathing?
Yes, you breathe the air enriched with oxygen, but under the pressure. And because it's under the pressure, this oxygen penetrates inside each cell. Because sometimes we breathe, but the oxygen remains in the vessels, but not goes inside the cell. And our cells suffers without oxygen. And when you breathe, in this chamber, all the cells are energized and we decrease any inflammation, we improve blood circulation. It's amazing for brain clarity. So instead of drinking a cup of espresso, you can have H-bot therapy and you feel this energy.
I did it once in Los Angeles. Theirs was more... The one at the Aeon's different because it's like a smaller kind of...
Yeah.
It's a pod.
That's
what it is. It's a pod.
Yeah.
In LA, it was like you could kind of lie in it. It kind of was as if you're like in a spaceship kind of thing. And I'm never claustrophobic. But after like 20 minutes, I was like, get me out of here.
Yes. Okay.
I was like, I need to get out of here. I don't know why I felt like that.
Because it's so closed.
It was closed. And
you laying down.
I don't know. Sometimes like maybe when you just get in your mind something and it was like, oh.
Here it's more comfortable because you are sitting and you also have this transparent glass and you can see even look at TV. So it's
look at
much
Queenie while she's giving you an IV.
Something that we haven't talked about, and I'm kind of really, I've heard a little bit about it, but I don't know a lot of it, was for my hair, I had was it PRP?
Yeah.
And they take the blood and they spin it and then they inject it in.
Yes.
But the last time that I had it done, the guy mentioned to me, this was in Mallorca, of course, about stem cell.
Yes.
And I thought, that sounds too space age. That's futuristic. I'm not getting involved in that. But I'm hearing more about it here. So it's kind of triggering things in me, and it's making me think, maybe I should have asked more questions. Is this the kind of new way that things are going, this stem cell, and what is it really? Is it taken from your own body, or is it something that's manufactured? Or
so in general, yes, stem cells, it's like a real fountain of youth for our body. Our organ has own stem cells. For example, our hair has stem cells. Our skin has stem cells because if we cut, the skin regenerates.
Okay.
Each our organ the same. But with age, the potential of regeneration decreases, and that's why we need these stem cells
like
to
a booster.
help. Yeah, to help heal and to rejuvenate all our cells and organs. So in this case, there are two possibilities. We can create your own stem cells. So when we take the fat from abdominal fat, we send it to laboratory, and in laboratory they can grow your own stem cells. These are called mesenchymal stem cells from the fat tissue. And then we can inject them into the hair, into the skin, and also even IV. We can, and then they will rejuvenate all our organs. But our stem cells also age like we age. So it is better if these stem cells are taken, they are called allogenic stem cells, from or younger patients, also from fat tissue or from umbilical cord.
Oh my God.
They are the most potent stem cells.
Right. So,
Yes.
Wow.
David, we have a friend, he's obsessed with this stuff.
Yes.
Like, you and him, he would just spend like
All day.
with like a fucking month with you.
Yeah.
And he's recently, well, not him, his wife has just had a baby. And he kept going on and on while she was pregnant. So he speaks Spanish. They speak with each other in English.
Yeah.
She doesn't speak Spanish. So he was speaking Spanish to me, and he's like, yeah, like, I think I'm going to like get the placenta and I'm going to get this made with it. And I was like, you should probably be asking her because it's her body, David. And I was like, it's not yours. Like, stop being like, you know, a man
Selfish
and
about
selfish. But they have got everything, and they've got it. There's a place in Spain, they've got it reserved in case anything happens to Carla, the baby, or if they need it.
Really? Yes, yes, and it is really
do that.
possible. And now we understand that
crazy.
we cannot throw this fountain of youth.
No.
It's because it's not only about anti-aging, but stem cells can save lives.
Yeah.
Right.
A lot of people with these chronic diseases, and we can heal them.
So if I wanted stem cells, do you need to then find someone that's compatible with me, or
We don't need, because if we talk about mesenchymal stem cells, if we talk about hematopoietic that come from the blood, yes, in this case we need to be compatible.
Okay, right.
In case if we use mesenchymal, it's another type of cell that we don't need to have compatibility. It will not cause this graft versus host disease.
Okay.
Right.
See, this is something. See, this is me giving my mom doctorly advice. You should definitely get working on your hair
Yes.
now.
Yeah, exactly. I know.
Because
My
I
mate's
work on my
already
hair
taken
now.
Me there.
I rub in minoxidil,
Minoxidil, yes.
and it is insane. The new hairs that I've got, it's ridiculous. And I've also done at the Aeon the PRP as well.
yeah.
It is a bit spicy.
But that is the thing. Yeah, it is a bit spicy. That that is the thing. Also, because the menopause is something that people don't want to talk about.
Yeah.
There's not enough. To me, there's not enough discussion around
Yes.
it, because it's taboo. Oh, she's just going through the menopause.
Yes.
But it is a serious thing for a lot of women.
Yeah.
I would say I've been relatively lucky in going through it. I was affected by my sleep pattern and the raging heat running through me.
She kept talking about it being hot.
So
freezing.
it was the middle of winter, and
Yes.
I was like, how hot is it? But I know other women, it's very distressing, and hair loss is a big conversation thing.
absolutely.
Because, your hair is like your crown and glory, they would say. And, every woman wants to go out and have lovely long hair
Yes.
and thick and luscious. And it's not always way. And that was why it was suggested to me about the stem cell thing. And I thought, no, but now you've got me.
Well, so now you're getting stem
I'll need to
cells.
yours.
I'm getting some rejuvenation bloods in there and out there, and
And getting sunscreen on your hands.
I'm getting no, I'm not getting sunscreen in my hands. I'm getting skin boosters and everything.
Yes, it will be like
Everything
a longevity
Dr. Lica
journey. Yes.
I know we've already had about 6 million treatments.
Yeah.
We've got other ones to go. I love it.
Oh, I love it too.
Thank you so much for explaining everything to us.
Being so patient and explaining it all to us.
I know. We will be seeing you. I think it's tomorrow. We've got another appointment.
You have indeed.
I do.
Oh, thank you so much, Doctor, for taking the time out of your day. We know how busy you are and we really do appreciate it. Thank you so much.
Thank you. Thank you so much. You are amazing. You look like friends.
Because of you.
Not like mama and
Because of you. I know. We were in a shop the other day and I went away in front and I could hear the shop assistant say to Mum, "Oh, are you guys sisters?" And I just went, "Yeah." I was like, "Oh, for God's sake."
She gets so annoyed at that.
I'm like, yeah, whatever.
Yeah, whatever, you know.
But if you guys watching want to check out Dr. Lica, we will have everything below. We will also link the Aeon Clinic as well. You can see all the treatments. We definitely
We'll recommend.
Like, cannot recommend enough. And we can't wait to be feeling amazing and more youthful from our trip from
Totally
Dubai.
rejuvenated.
Exactly.
Exactly. So thank you guys
so much, guys. I hope you enjoyed this episode and we'll see you at the next one. Bye.
Thank you. Bye.